All right, good morning, everyone. It is Wednesday, November 29th. This is the Senate Health and Welfare Committee meeting. This morning, we're taking a short 1 hour look at general assistance and emergency housing. For the past several years, there have been significant concerns about folks who are without shelter and without housing or who are losing it. It's been a huge concern for many of us. In each of our districts, I think, we see people who need support services. And to that end, we've looked at different bills and passed different language. And last year in particular, we passed Act 113, which was the big bill, the budget. Within that budget, there was language about how to support people with general assistance housing and also with adverse weather housing. And so the legislature, this committee worked very hard on that to ensure that people who have specific needs would see that their needs are met and that housing would be available for folks until they could find their own homes, more permanent housing. So what we're doing today is getting getting the backdrop from Ledge Council. Katie's going to do that with us in just a minute. And then we'll hear from Miranda Gray, Deputy Commissioner from the Department of Children and Families Economic Services Division. Tomorrow, we are meeting jointly with House Human Services to look at the report that's come to us from a task force on housing, general assistance. It's really, let me rephrase that. Of course, it's about housing, but it's about people. It's about the people who have critical needs. It's about people with disabilities. It's about the people with children who have lost their homes and need to find a place to live while they go to work or get their kids to school. So it's the title here is emergency housing, but it's really about finding the safety net for people in dire straits. So we can talk about that another time, but tomorrow we will be meeting jointly with House Human Services. And so to get us started, Katie, you want to share some of the budget language as context for us? Well, you go ahead and do what you're going to do, but you always do it better than I can.
Good morning. Katie McLean, Office of Legislative Counsel. So I'll share the budget language. Before I really jump into this language, though, I'm sort of starting to forget what I've said in this committee and said to your colleagues in other rooms. But I think sometimes we hear GA emergency assistance and we think that general assistance is only emergency housing, but the general assistance program is much broader than just emergency housing. It provides other services, help with fuel assistance. It provides burial services for individuals who die indigent. So there are lots of other components of GA. Emergency housing is one of them. This language is in the budget. And that is because if you look in statute in the green books,
that's our 16.
Okay.
Could you shut the door, please, sir?
Sure.
Yeah, we're only allowed 16 in here. You're number 16.
Okay.
You're lucky.
I'm going out of oxygen after though.
Okay, our room is full. Oh, it's Nellie. All right, go ahead.
So this language is in the budget. It's not codified in the green books, and there are always ongoing conversations about what emergency housing looks like from year to year, because it's sort of a package that's negotiated as part of the budget every year, depending on what emergent needs exist, what fiscal resources are available. So what we are looking at right now is the budget that was passed last May. And so this is the emergency housing package, for lack of a better word, that's in place for this current fiscal year. So it started July 1, it will end June 30th, this particular iteration of emergency housing. So with that said, we can jump into the language. To the extent that emergency housing is available and within the funds appropriated, the Commissioner of DCF is to ensure that GA emergency housing is provided for this fiscal year that we're currently in to households that attest to lack of a fixed, regular, and adequate nighttime residence and have a member who. So we're about to look at a list. A household that is eligible for GA emergency housing has to have a member who falls into one of these categories. So a member who is 65 years of age or older, has a disability that can be documented by receipt of SSI or SSDI, or a form developed by DCF as a means of documenting a qualifying disability or health condition. And that form would require the applicant's name, date of birth, last 4 digits of their social security number or another identifying number, a description of the applicant's disability or health condition, a description of the risk posed to the applicant's health, safety, or welfare if temporary emergency housing is not authorized pursuant to this section. The form would also have a certification of a healthcare provider that includes the provider's credentials, credential number, address, and phone number. So that is all related to a household member with a disability. Alternatively, the household has a child who is 19 years of age or under, has a member who is pregnant, has a member that has experienced the death of a spouse, domestic partner, or minor child that caused the household to lose its housing. The household has a member that has experienced a natural disaster, such as a flood, fire, hurricane, has a member that is under court-ordered eviction or constructive eviction due to circumstances over which the household had no control. A member that's experiencing domestic violence, dating violence, sexual assault, stalking, human trafficking, hate violence, or other dangerous or life-threatening conditions that relate to violence against the individual or a household member that caused the household to lose its housing. So those are the categories that were outlined by the General Assembly as being eligible for emergency housing. And then we start looking at, well, what does this housing actually look like? So our first sentence is that the emergency housing is to be provided in a community-based shelter whenever possible. If there's an adequate community-based shelter available within the AHS district that the household presents itself, the household shall be provided housing, emergency housing in a hotel or motel within that district, if available, until shelter space becomes available in the district. So the state is broken up by various AHS districts. A lot of the conversation around the formulation of this language was not expecting a household to travel outside of their the area where they live. So first presenting themselves to find a shelter. If there's no shelter available in that district, then moving to emergency housing in a hotel or motel until community shelter becomes available. The utilization of hotels and motels pursuant to this subdivision is capped for 2 periods during this fiscal year. So it'd be capped at 1,100 rooms per night between September 15th and November 30th. That's already expired, obviously, and coming up between April 1st and June 30th. So during those 2 periods, there will only be 1,100 rooms available for hotels or motels. In subdivision 2, the maximum number of days that an eligible household receives emergency housing in a hotel or motel under this section for the 12-month period is not to exceed 80 days. So while a person can receive community-based shelter for an unlimited number of days, the number of nights in a motel or hotel is capped at 80 days. There's an exception to this when the clock on the 80 days stops, and that is sort of during the winter weather. So you'll see in subdivision 3, that the department is to provide emergency winter housing to households meeting the eligibility criteria that we just talked about between December 1st and March 31st. And that emergency housing in a motel or hotel during that period does not count towards the 80-day maximum count. And then we have language in subdivision 4 that notwithstanding any rule or law to the contrary, the department shall require all households applying for or receiving emergency housing to engage in their own search for and to accept any available alternative housing placements. The applicants and eligible households shall regularly provide the department with information, not less frequently than monthly, about their efforts to secure an alternative housing placement. If the department determines that a household at the time of application or during the term of the household's authorization has not made efforts to secure an alternative housing placement or has access to an alternative housing placement, the department shall deny the application or terminate the authorization at the end of the current authorization period. And then we have a definition of what is meant by an alternative housing placement. So that can include a shelter bed or pod, placement with family or friends, permanent housing solutions, including tiny homes, manufactured homes and apartments, residential treatment beds for physical health, long-term care, substance use or mental health, nursing home beds and recovery homes. And subsection 3, emergency housing provided pursuant to this section is to replace previous categories that the department created in rule. They were called the catastrophic and non-catastrophic categories. So this sort of does away with those categories that were in rule and treats the whole population with an eligible member in the same way. Subsection D, emergency housing emergency housing required pursuant to the section may be provided through an approved community-based shelter, new unit generation, open units, licensed hotels or motels, and other appropriate shelter space. The department shall, when available, prioritize emergency housing at housing or shelter placements other than hotels or motels. And then in subsection E, we have language about case management services. So this directs that case management services provided by case managers employed by or under contract with the agency or reimbursed through an agency-funded grant shall include assisting clients finding appropriate housing. In subsection F, this directs rulemaking. So this directs the department to adopt emergency rules for the administration of this program, also to adopt a permanent rule. So permanent rules take sometimes 9 months to adopt. So the idea is that the emergency rules would be kind of a stopgap until a permanent rule with regard to this language has been adopted. But then we have language about reporting. So on or before the last day of each month from July 2024 through this coming June, the department or other relevant agency or department is to continue submitting reports similar to previous iterations of emergency housing reports that were submitted in the previous year. And when we walked through that chart with all of the reports, you see that you got a number of these reports in on a monthly basis. Subsection H for emergency housing provided in a hotel or motel. At the beginning of this fiscal year and thereafter, the department is not to pay a hotel or motel more than the hotel's lowest advertised room rate and not more than $80 a day per room to shelter a household experiencing homelessness. The department may shelter a household in more than one hotel or motel room depending on the household size and composition. In subsection I, this is talking about what rules apply to this program. Rules already in place around general assistance are applicable. Department of Health rules about licensed lodging establishments apply to the hotels and motels that individuals would be staying at. Same for Vermont Fire and Building Safety codes would apply to the hotels and motels that people are being housed at if they're participating in the program. In subsection J, subdivision 1, the department may work with either a shelter provider, or community housing agency to enter into a full or partial facility lease or sales agreement with a hotel or motel provider. Any facility conversion under the section has to comply with the Office of Economic Opportunity Shelter standards. And subdivision 2, if the department determines that a contractual agreement with a licensed hotel or motel operator to secure temporary emergency housing capacity is beneficial to improve the quality, cleanliness, or access to services for those households temporarily housed in the facility, the department is authorized to enter into those agreements in accordance with the per room rate identified that we looked at. That was the $80 a night. Provided, however, that in no event shall such agreement cause the household to become unhoused.
So Katie,
Yep.
we're zooming through this stuff, but
Mhm.
at some kind of a global frame of what exactly what a person is going through to get.
Sure.
And at some point, and it was that 80 days and that.
Yeah.
Gap.
Yeah.
Some things went seriously wrong.
Right.
And
So that
there was apparently, we thought that the commissioner had emergency power, and the legal opinion was that he didn't have the power to make exceptions. So we had
so
some
we'll.
people who shouldn't have been out on the street, out on the street.
You're right. So, and one of the questions that I'm going to ask is for you to go through maybe how the rulemaking process is.
Sure.
But keep going. So remind us where we are right now.
Okay.
We're on page what of the big bill? 190? No.
189.
189.
At the very bottom, we're almost done with this
Yeah.
language about GA. There's a subsection K appropriating 500,000 for security costs related to emergency housing, and then we have definition sections. So community-based shelters, we have the housing, community-based shelter means a shelter that meets the Vermont Housing Opportunity Grant Program standards, provisions of assistance. Then we have a definition of household, means an individual and any dependents for whom the individual is legally responsible who live in Vermont. It includes individuals who reside together as one economic unit, including those who are married, parties to a civil union, or unmarried. So that is the emergency housing language. You'll see that there is also a section to ramp up emergency shelter capacity. I'm wondering if you want to just hold on that for a moment, or if
Let's
you
hold
want
on that for a minute.
Okay.
Let's understand what a person can access through the budget provision. So the conditions, who's in the household, because we have that. So then,
So I guess I'm not entirely
well,
sure.
how would they apply? How would they get shelter? That's
Oh,
take us
so-
the steps through from what's here.
Okay,
Go through.
so if there is a household who has an individual that meets one of those eligibility criteria, they would present themselves to DCF. The specific manner of that, you'll have to hear from the deputy commissioner, but they would make an attestation that they do not have housing on a regular basis, and the exact language around that attestation. Making everybody seasick here. They have to attest to a lack of fixed, regular, and adequate nighttime residence. So that's the attestation. So assuming that they can make that attestation, they have a household member who meets one of those eligibility criteria, then first the department would be looking for a community-based shelter in the district where the household presents itself. Assuming there is not community-based shelter, then the next step would be to look for a hotel or motel within the district, the AHS district that they presented themselves. To the extent emergency community-based shelter becomes available, that the language indicates that the person would be in the community-based shelter when it becomes available.
Does that mean that the person who's in the hotel or motel would be moved from the hotel or motel? Or are they allowed to stay there for 80 days?
That is a question. How it's being administered is a question for the deputy commissioner, but the language does say that they are staying in a hotel or motel until it becomes, here it is.
Until what?
Until adequate community-based shelter space becomes available in the district. So here, I'm gonna scroll up so we can read the whole sentence.
There was a mass evacuation, when the 80 days were up in October. I live across the street. I saw the cars packed up. And there were no shelters open.
So let me just take you through the sentence again. If there's an adequate community-based shelter space within the AHS district in which the household presents itself, the household shall be provided emergency housing in a hotel or motel within the district if available until adequate community-based shelter space becomes available in the district. And then just a reminder that there is a cap of 80 days on using a hotel or motel. However, that maximum is sort of on hold during the cold winter months. So there's any hotel or motel days used between December through the end of March does not count towards the 80 days. There are also room caps in place for 2 periods of the year, in the fall and in the spring, and those are room caps of 1,100. You asked about rulemaking. So
Before you go there,
yeah.
before you go there, so that's what the person is looking at.
Yeah.
What they're applying for. Then the responsibility, the next section indicates some responsibility on the part of the department to identify and find hotels and motels or shelters. Can you just talk a little bit about the meaning of that language, what the responsibility of DCF is with respect to these folks?
So the language indicates that if there is housing available, that DCF is going to make a placement. The lead-in language here, to the extent emergency housing is available and within the funds appropriated. So DCF is operating within a budget, and you know, there are limitations on the amount of emergency housing space that may be available.
Well, I guess what I'm getting at is, it's not the responsibility of the family to go find the hotel room.
Oh,
But
I
DCF
see.
has already accessed a facility, a hotel room, and now they're paying no more than $100. What is the current rate?
currently DCF doesn't pay more than 80 a night.
So now it's going down to $80 a night. Okay, and so the negotiation has gone on already between DCF and the hotel or motel. And in the meantime, and DCF is identifying shelters, because I know we put language in on paying for shelters in the budget. Yeah. What am I missing there?
The only.
Well, Miranda will, Deputy Commissioner Gray will let us know what I'm missing.
Well, she's in a much better position than I am to talk about what negotiations
Yeah, sure.
happen with the hotel and motel providers. The other piece that I'm sort of thinking about is the obligation to continue to look for alternative housing placements. So this language is indicating that the the household is responsible for continuing to look for an alternative housing placement and communicate with the department about what that placement looks like. Would you like me to turn to rules now?
Yes.
Okay.
I didn't mean to put you on the spot.
No,
I'm just trying to get the
that's okay.
full context.
So the rulemaking process has been ongoing. Emergency rules last for 90 days. Is that right? Or 180 days?
180.
Thank you.
Yep.
180 days. So at
It's
this
helping
point,
me on Elkhart.
well, thank you. Glad we have. At this point, permanent rules have not been adopted, although they have been considered by LCAR. So there have been a few iterations of emergency rules that LCAR has considered. LCAR has raised some concerns about some policies.
What is the newbies? What is LCOT?
Oh,
Oh, the Legislative Committee on Administrative Rules, and I'm on that now. I will be off of it next week. But we have been considering these rules. Well, we've been considering rules related to general assistance housing for like 4 or 5 or 6 years. I've never read a total number, so, and now we're going through several iterations. I don't know whether it's several different, but we're going through emergency rules over. Yeah, that.
Yeah. So to catch you up to speed, the emergency rules, LCAR decided, not to take a position on. There were some concerns raised. There was a letter written, expressing the concerns of LCAR, and why it decided not to, approve the rule, that took no action. And now the permanent rule is, before LCAR. LCAR heard from the department and from advocates 2 weeks ago, and tomorrow they're going to continue their discussion about how to proceed on the permanent rule. Do you want me to speak to some of the specific concerns that LCAR raised, or?
Yes, if you can, just
Okay.
briefly, the ones that stand out would be helpful.
Some of the things that were standout items for LCAR were the fact that there was a resource spend down, that a household had to spend down its resources before it could be eligible. We had sort of talked about, I'm getting too far into the weeds, how at one point there were 2 categories, catastrophic and non-catastrophic. At one time, one group had to spend down, the other didn't. So now that the groups are together, there is a population of individuals who are eligible for GA for the first time ever having a spend down. And there has been policy discussions about how policy spend down ultimately hinders a household's ability to save for something like a
Say the
safety deposit on
30%.
an apartment or what have you. So that has been an issue. Another issue raised was that while there are 8 categories listed in statute of who is eligible for housing, the rule specifies that during the 1100, the periods of capping the rooms at 1100, there's sort of 4 priority categories within the 8, and the statute is silent on that fact. So that was sort of a policy decision made by DCF that LCAR had concerns about. I think those were the big ones. Yeah.
Yeah. Explain a little bit about the priorities again.
I did not bring
Okay.
my rule with me.
Never mind.
No, I can. So all from the top of my head, but so there, as I said, there are 8 categories in statute. The department, in determining how to use the 1100 rooms allotted, made a decision that they would prioritize 4 groups within the 8. The conversation or some of the testimony was that those populations were, or that list was developed in consultation with the health department. And that list was put in place, and that those individuals would sort of be served first. That doesn't mean that somebody else who is in one of the 4 categories that is not on the DCF priority list couldn't get housing during that time. But there's sort of a system where the priority groups can call in first, and what is remaining, there's a later time for the other lesser priority groups, I guess, to call in. So there were a lot of concerns
It gets
raised around that.
confusing, and yeah, no, and honestly, when you think about administering it, there are some difficulties there, so we'll have to hear from DCF about that. Questions for Katie?
You say call in. They had to call in every day, right? The 211 number to see if they could get a room that night. So you packed up in the morning and left. And then you didn't know if you were going to have a room that night until you called in.
I'm gonna let DCF answer.
Okay.
That's a DCF question, and it's part of the whole rulemaking and procedure stuff that has caused so much concern. You got it.
I've been dealing on the other end.
You know it. Oh, okay. All right. Are we good? All right, so one person who is sitting in a reserve seat over by the table is going to have to leave her seat. So these are,
Sit over there.
so the two seats next to the table are reserved. So if you don't mind.
We have an extra.
Yeah.
You're good.
We have another seat over there. Thank you, Katie. Thank you all for voting. Musical chairs in this room.
I maintain we have a lot of empty space on top of those cabinets.
Right. That's where my cat will be.
No, that's, there were times.
Stool is setting.
Get on the windows.
No,
I break it.
I think just while we're thinking about that, Miranda, while you're coming up, there was a time pre-COVID when there were no restrictions about numbers of people in here, and I
Oh,
once
really?
counted 38 people, and they were standing all around. It was a little can of sardines.
That's too.
So it is way too much. So
I don't know.
something,
Regularly sat along that wall chairs.
yeah.
So if you move that, you can.
Good morning.
Morning.
I think, do you know everyone at the table? Let's introduce ourselves. So we'll start again.
Senator Larry Hart, Orange County. We've met each other this one.
Sam Douglas from Orleans, Canada.
Jenny Lyons, Chittenden Southeast.
Francine LaRock, Chittenden Central.
And Abe Cummings right here, Washington.
Thank you. Thank you for being here. You've got your water and are you getting better? I hope or
I
not.
am getting better.
Okay.
Thank you. I do apologize if there are times where I just go into a coughing fit. I'll just need a moment, but hopefully we'll be brief.
So we're, as you can see, we're interested in the way the whole program is running and being administered. And then some of the glitches that we've heard about and the perspective from DCF. So, and tomorrow we will hear from the task force, but we need to hear from you first.
Do that. For the record, Miranda Gray, the Deputy Commissioner for Economic Services Division that is housed within the for Children and Family. Would you like me to? Thank you. I have some big house.
It's a whole
Okay.
basket full of.
This is the health and welfare.
Just.
I do, we're taking
That
that.
doesn't help, maybe.
All right, I feel like well cared for. Thank you. I do appreciate it.
Senator Bullock, great.
Would you like me to share the
Yes,
presentation?
please. And we're pretty flexible on time because our next, the next things that we're doing can be compressed a little bit.
All right. So I'm happy to take questions as we go through, if that's helpful. Understanding that there is a lot of nuance to what the General Assistance Emergency Housing Program. So this first slide really just tries to break down for you what Legislative Council just went over for you, but what are the eligibility categories, because those did change. An item that I'd just like to mention is that cold weather is different. So in the past, anyone was able to say, I don't have somewhere to stay, and they were able to be housed. And that is not true. This winter, you have to meet one of these eligibility categories. And that is tied to some funding that my sister office, the Office of Economic Opportunity, received to be able to stand up shelters. And I'll talk about that high level, just because that's not my area of expertise. But I do think it's a really important component of a change that happened this year.
as was mentioned, there is an 80-day limit. And it is our belief, after having reviewed it legal, that there is no waiver there. You have 80 days, and that is from July 1st until October 31st, and then November 30th. And then again from April 1st until June 30th. And so we have a population who use their 80 days this summer into fall. And then we have some people who have not used their 80 days that we are currently having that will have access to those 80 days this spring. And that, once again, goes until June 30th. There's a couple of other, I think, important factors for folks to realize. So within Act 113, there was a pretty significant change that happened. And that is people who present themselves attest to a lack of a fixed, regular, or adequate nighttime residence. The change here is that ESD used to verify. So if you came to us and said, I can't stay at my mom's anymore, we would call mom and say, are you sure that Miranda's not able to stay with you anymore? And if there was like, no, Miranda absolutely can, then you wouldn't be eligible for GA. So this has impacted poor housing.
Do you have any other examples of how you verify that?
So if someone had an eviction, we would call to understand that.
So it goes to just call.
It would,
Okay.
or if there was other documentation, if someone had the documentation with them, then we wouldn't need to call, but that is a service that we offered to be able to help remove that barrier for someone if they didn't have to get the proof themselves, if we were able to assist. So, and then another major change that happened within Act 113 is prior to that, clients were not eligible if they caused their own loss of housing. So if you hadn't paid rent, you hadn't been going through a formal process because maybe you had good reasons to not be paying rent. But that has changed. So now, even if you caused your own homelessness, you are still eligible for the general assistance program. So as you might imagine, each time we add these flexibilities, it increases the population that is coming to economic services. So the next slide is there has been a lot of conversation, and I will say that I took very seriously last year a lot of feedback that we needed to do more, that we needed to make sure that people understood the rules, which has been challenging because this general assistance program has had countless rules since the pandemic. In some years, there was 3 different sets of operations that we were working under, which is really hard, not only for the Vermonters that want to engage with us to understand, but also for our staff. And then for our community partners to understand how might someone be eligible or not. So
I'm gonna have to step out with this. So would you mind if I ask my question now?
no, please.
Thank you. A few years ago, we had a joint meeting around the GA program. I think it was in the summer. And I remember one gentleman with lived experience who was attending had talked about the forms that he had to fill out as a real barrier to getting the housing and support that he needed. And we had talked about going to like a single form. I was wondering if you all have made any progress with that.
So that is a bit out of my purview because I also did look at are the forms that we're asking people to complete, which is pretty minimal, because most people are engaging with us over the phone. We're actually taking their information and making sure that yes, this is true and complete. But I think my understanding is when you are looking for a subsidy, if you're applying for apartments, right, each organization has their own, and so I think that is was the pain point. And I do believe there are organizations that are looking at it, but it depends, is it state-run program, is it federal? And is there an ability to find common ground, or do people need their specific things?
So it sounds like maybe not so much, but thank you. I appreciate you taking the time to answer.
Yeah.
Yeah, okay.
So we have done quite a bit of communicating to the hotels. We have met with the owners or their managers, whomever they would like to engage with us. We are trying to make sure that there is a lot of communication. If there is something, an issue that's brought to our attention, is that we're following up by email. We're also putting, sending them letters. And if they want to have meetings, then we do that. We have put numerous communications to clients. Truly, the most effective is when people are housed with us and we're able to slip things under their door. We also put items in the mail, but most of that is returned. As you might imagine, a lot of people don't have a permanent address, and so that is just coming back to us. But we are happy to try to engage in any way that we have the ability. We don't have all the fancy tools, unfortunately, to be able to communicate in some of the ways that maybe we're used to being communicated with from like doctor's offices. We've also held community partner meetings to make sure that they are aware of what are the current rules, what are procedures that we're having to put in place, where do we anticipate that we might have some pain points, like high call volumes, just so that people are aware. And then I have also met with a lot of municipalities, because I think one of the things that has not been highlighted is the strain that has been put on municipalities to try to provide services to the folks that we're housing in hotels and motels.
That was quick.
We've also provided training for our staff. Because as you might imagine, as we have these changes, we need to be able to make sure that they can administer them. We've done extensive planning for when we had to implement the room caps, or even the number, about the 80 days and then the 1,100 rooms. And then I highlight, because one, the first part of the law went into effect on Monday, July 1st, which is often when people are beginning their summer vacations. That was not what economic services was doing, because we needed to plan. We needed to make sure that people knew that how to reach us and and how they would have their room. The same, the next big date was a Sunday, September 15th. And so it was my team and one of our contractors, not our after hours 211, which was mentioned, who worked on a Sunday to ensure that people had a contact, that they would have someone that was picking up the phone. Going into that Sunday, September 15th, we were using 1,420 rooms, and it had to be down to 1,100 per law.
So, I mean, the question is the 300 people that were moved out of the hotel. Yeah, can you characterize that a little bit for us? We'll probably hear more. We'll hear more lived experience, but you have some information out of it.
Yeah, I mean, I think it runs the gamut. It was family. For those, because some people had chosen to leave, it could be an older reminder. It could be people with a disability. It is not easy to decide who stays and who goes, and I'll get into that a little bit more here. But we did try to keep house the most vulnerable, and I will say that we did consult with colleagues at the Department of Health. Originally, we didn't have people that were experiencing some form of domestic violence on this, but after understanding more the impact for those individuals and the higher rate of suicide for them, it became evident that we needed to include that as a group would be housed. But there is no good option, if I'm being perfectly honest, because when I say that, I'm also saying we've experienced 2 floods in the last 2 summers, and that isn't a priority group if that was your sole reason, which is incredibly hard, because I will tell you, it is also economic services who will go out and help run the different operations to make sure that we're engaging and supporting Vermonters to the best of our ability. So we might have to tell them, I'm sorry, we can't help you over here, while we're trying to offer them assistance elsewhere.
There's another piece of this that we haven't talked about in terms of how this stuff got into place. And that is, there was a large bill that came over from the House to the Senate, and then this committee passed it down to appropriations. We made a few changes to it. And then it was really a negotiation during the budget process with the administration and all of it, trying to sort out how much money we have to invest and how many people we can cover. Wasn't a simple task.
Correct. So the next really critical date was Thursday, September 19th. That was when we had people that were starting to reach their 80-day limit. and would naturally kind of fall off of the program. We implemented an administrative procedure, and I'll go into that in a couple more slides. But that really only had to stand for about a week, and then we were under the 1100 room cap, where I should say the administrative procedure only goes into place when we're within 90% of the room cap, the 1100. So this fall, it didn't stay in place for very long. And then once again, we had another Sunday. So December 1st is when cold weather began. And once again, it was my team, our contractor that is in 2-in-1 who worked that day. We had also done a lot of outreach. We had extended our hours. We typically are only open until 4:30. We stayed open until 6 p.m. on the phones to be able to try to connect people. We offered to community partners if it would be helpful for us to come on site if they had a large group that came, because we were pre-authorizing. So anybody that we knew was going to be eligible on Sunday, December 1st, we were working to get them a hotel room on that day, which did involve us having to assess who went because plans change for people, as you might imagine, so that we could ensure how many rooms did we have open, because we were incredibly busy on December 2nd as well, that Monday, of people who were still looking for assistance. Another piece that I had mentioned. Do promise I'm not contagious. Just gonna have this one for a little bit. Another piece of the legislation that was passed with like $10 million to be able to open new shelters. And I can assure you, we have worked really hard long before this summer. We were having communications, and by we, Commissioner Winters, and then the Director of Office of Economic Opportunity, Lily Sojourner, and I have had multiple meetings with municipalities. And what I'll say is, it is really challenging. There are a lot of barriers to being able to open a shelter, staffing, space, and then the desire of a community to have a shelter. I'm just going to be really honest, it is a significant barrier for us to overcome. But we continue to have a lot of conversations. There is a slide coming up where we have made progress, and I do want to thank our community partners who have stepped up, who have been really creative, who've added, even if it's just 5 more beds, those 5 more beds really do make a significant difference, and continue to persevere through the barriers that they're faced with. We also, and I just want to be clear, outside of the $10 million, because sometimes that gets confusing for folks, outside of that $10 million to stand up shelters for this winter, we also opened the Waterbury and Williston shelters, and those are 2 family shelters. Between the 2, we can support about 17 families. Those have been typically full. Since we have opened them here and there, we might have a room that is open, but we also are trying to wrap support around people, bringing in any connections that people might need to try to help overcome barriers and help them be successful in navigating forward. A part of the $10 million that was a part of this legislation, we did issue a notice of funding. There was a lot of conversation around that, about what could happen and the need for us to be able to bring things on now. So something that might be able to come to fruition in 2 years wasn't really going to help us the now. So still, like, how do we have those conversations? Because we don't want to lose any momentum of something that might be able to happen in the future, but we really ultimately needed to also be able to focus on what can we do for that group of Vermonters in particular who are not going to have access to a GA motel room.
Question about the shelters. So Williston Shelter obviously is in a good place in terms of access to services and food shelves and all of that. The Waterbury Shelter, how accessible is that? I'm trying to remember when it was presented.
But down by the interstate.
It is by the end.
It is, if you're
Transportation.
young and healthy, it's, you
Yeah.
can walk to town, but it's a little ways out.
And I do know that we've had, volunteers who will help get folks places.
Yeah.
as well as a partner who is on site. But we do try to make sure that people can still get to where they need to be, or that we're bringing. So I would say, like, for those that might also be on another program that oversees the REACH program, we ask the case managers to go there if the family isn't able to come out. So that way we're removing that barrier.
So then the other question about these two shelters, is there any thought of having them being taken over by a 501c3 or making them permanent? Because I know that they're not right now permanent, right?
They're not.
Any thought on making that happen or helping to have that?
So not speaking too much out of turn, I believe it once again becomes the legality of who's running that shelter and then having to go through zoning, which can be a lengthy and sometimes it ends the process.
Well, yeah, I know, but if you thought if there were a way that, for example, Cots and Burlington could walk out to Williston and do something there, is that a thought that then?
We definitely had a lot of conversation, even when we were standing up. I turned first to our community partners that were here to see what might they be able to do. And I do think for all of us, right, there are staffing issues,
of
the
course.
inability.
Yeah.
So, but I think we continue to have the conversations because it is really important to us to be able to understand what can we do. And I do feel like Waterbury has been very welcoming. I think around the holidays, they helped pull different things together for the families that were in that one. And I think the same for Williston. We've been very fortunate with just how welcoming those communities have been. If you haven't been introduced to our website, I did include this link here because it has a lot of information. So this is a part of Act 113 as well that we have been asked, and really it dates back to legislation before that of people want to understand who we're housing. And so we update this website every single week. It is updated Tuesday mornings, usually by 11. I would say you can go in and see what has changed from week to week. All the past documentation is there as well. All of the different communications. So any letter that we put out to the community, to the hotels, to the Vermonters that are staying, and the hotels and motels, like that is there as well for folks, and as well as different resources, the laws that we're operating under, whether or not we're under the administrative procedure. Another, I think, important piece for everybody to understand is that we've worked with over 5,200 unique households from July until December 31st. It's significant. And part of the reason I highlight this is there's a fair amount of movement that is happening. So, and I think Senator Lyons, you had asked about when people just stay in their room. Like if we authorize them for 80 days, which I'll come back to that because no one gets an authorization for 80 days to start. But it's some people who might show up and they might stay a day or two. Some people don't show up. We have others who will stay with us for their duration. They use their 80 days and now they're in for cold weather, and then will remain until they're no longer eligible. But it truly varies, and I think it's just because we are working with folks who have a lot going on, and something might work for them one day and it might not work for them another, or they have other opportunities. Although it's hard for us to actually know where people go because people don't have to let us know if they get housing. It's great if they share that with us, but they don't have to. But we do have people who are successfully moving into their own apartments. We also have some people who are seeking treatment, and that's their next best step for them is to be able to go and engage that. And then sometimes it is reunifying with family or friends. And then for others, it is, and this is where it gets into the length of authorization. A part of being a good partner to the hotels and motels is understanding what's going to work for them. And I will say that a number of them now say that they want to be able to see if it's going to be a good fit. Because unfortunately for some of them, they might have an individual or a household comes in and within 24 hours, the room has been destroyed. And so they need to have that ability to be able to say, this isn't going to work for us. or we need somebody else to be able to come in and help. And who might that be able to be? And so it really ranges. We have some who is 24, 48 hours. We have others who will say, I'll do 3 or 4 days or 7 days. Until they understand that it's going to work. We also have income contributions. And I know we talked about resources, but currently the law says that if you have income, and we have a number of individuals who do, we have social security income, we have people who have jobs, who need to be able to pay for their room. They do not lose their room when they're paying. So just to clarify that, like if they leave, then that room is open. But if they choose to stay to pay their $80 for that for that night, it's usually, I want to say, because it's $80, it's about 3 or 4 nights that someone might need to pay. It can range. We at one point did have someone with over a dozen days they need to pay, but that was because of the level of income that they had. But that also, determines how long someone has an authorization for. So it isn't a consistent piece. And sometimes I think legislative council also had mentioned that we offer someone a room wherever we have one available. And to be perfectly honest, most of the time we are full. All summer long, we had people who were not able to house. So we had the groups of 1,400 households that were in. We had an additional couple hundred who were not, which is the same now. I have households, and they hit every category, who have never had access to a GA hotel room.
Sorry.
This is week-old data. So if you did go onto our website, you would see it's different. I think we have 1,386 households that we're housing presently. Sometimes the reason for the number of rooms being more is because we will have large families. And so they need more than one room in order to be able to accommodate their entire household. This also gives you a breakdown of how people are coming to us, what category. The disability by verification of a form is 201 GVR. This is also new. This is something that was put into place last budget adjustment. And so this gives a provider the ability to share with us that someone needs to be able to have a room. And this is a significant population will be, that is making up those that we are housing. This is, and I'm going to come back to that in just a moment. But this is another display. This is how many households we've been unable to house thus far. And I will tell you, this number has grown. It is now, I want to say it's closer to 600 households. And so this is anywhere if the number is small, we're not able to share that publicly. And then usually we also, for data suppression, also take away some others so that it still isn't an obvious of how much, what the number size would be in a district area. But this shows you that we don't have enough capacity to be able to house everyone that is coming to us, which is a part of the reason that we have the administrative procedure. This is the other piece that I wanted to highlight for you, just for you to be able to see. So between those that are disabled through SSI, SSDI, which was prior to the BAA, that was how you were determined to be eligible, and the disabled category. It's more than half of the households that we're housing. And this is where it becomes challenging when everyone has a priority. And so when I believe Senator Cummings had mentioned like this fall felt really stressful and there was a lot of people being exited, I had a lot of conversations, and I will tell you the conversations range from how can you exit any families? How can you exit any older Vermonters? What about the young population? They're very incredibly vulnerable. What about those with disabilities? And the honest answer is we just don't have enough room. And for us, we are having to make decisions every day. And those decisions, of those almost 600 households that we're not housing right now, that can be a mom who just had a baby and is being discharged from the hospital I'm sorry, we don't have a room for you. Meanwhile, we have a form that a provider has filled out, and these are actual examples of ingrown toenail, dry eyes. And for us, we have to take what a medical professional has told us. And we are having to decide. And right now, this is the part of having administrative procedure of us trying to understand, is it the 25-year-old who has anxiety and depression? Do they need this room more than the 72-year-old who is going through cancer treatments? And these are some of our everyday experiences. And there's not an easy choice for anyone. I do believe, like when we were having that conversation last spring, no one wants to draw the line. But for us, it is how do we manage and knowing that we aren't able to meet everybody's needs. So this gets into our administrative procedure. It is enacted when we're at 90% of the 1,100 room cap, or when we're in the 9% of the cap. So right now we're at capacity. So we have been since December 1st. Our rooms are full every day. We have to tell people, I'm sorry, you're not eligible. We have those that we feel are more high risk. It's the families, individuals who are pregnant, the domestic violence, those who are age 65 years or older, or otherwise categorically eligible and was over the age of 50. So that leaves you those who have experienced a death of a spouse or minor child, and natural disasters such as fire or flood. So under a court-ordered eviction, as I said, there are no easy ways for us to decide this. And I do believe Senator Cummings, you had asked about people needing to call. So the difference here is if you aren't a part of the priority group, is that you can call starting at noon. So we give the priority group the morning to be able to call for us. And then in the afternoon, we are saying if you aren't priority, but I'll say we have a lot of non-priority households that are still being housed. It isn't as though they're exited, but it is like any hotel stay that any of us might go, there's a checkout time. And that room would be turned over and then it would be available. There are challenges. There are certainly forces working against us to make sure that that isn't happening. And that's fine. Everybody has a role here, but we also have the authorizations that are shorter. This did change. It's now up to 14 days. So if you look at what do we need, to try to create some movement so that the 600 households that aren't being housed might have access to a room for the first time ever. I'm going to pause there. I'm going to transition a
So
little bit.
just a question on the previous slide. So the length of authorization, say granted in up to 28-day increments. What does that mean?
So if someone did not have any source of income, we could, and the hotel agreed, which is another major factor here for us, we could authorize someone to stay in that room for 28 days, and then they would need to call us at 20 days. However, what we also allow here in the priority group is that you can call us 10 days early. So before you reach, let's say your 20th day is tomorrow, you could call that starting last week to be able to say, like, I still need the room. I haven't been able, to.
How does that relate to the 80-day eligibility?
So the 80 days isn't currently in effect. But when
We're talking about the cold weather.
cold weather, but even when it was, then we are counting. And so you might not, if you only had 20 days left of your 80, the max we could give you is 20.
Okay, so now I'm getting really confused.
Okay.
Okay, so
All right.
we've got the cold weather availability and someone's in the hotel room for that period of time until April. But now what you're saying is they're only authorized for 28 days at a time. Where does that come from? I guess what I'm asking.
So it's historic, and there is something about having residency in motels, right? You stay over 28 days and that relationship can change. And then it is also part of our billing. So a lot of this also comes down to like, how often does a hotel want to be able to say to economic services, I would like to be paid? Is that every 2 weeks?
That's a different answer. So it's not that you're requiring the resident, the individual, to justify their staying. You're doing a favor to the hotel I'm trying to understand that.
It's both. So I think the other component I haven't talked about is, right, there are things that you need to do to engage and stay in a general assistance hotel room.
And so there are rules about
Engaging with
behavior.
coordinated entry, behavior. You're supposed to be, as Katie had said, like searching for your own housing. So if that's an option, that would be something else. So those are things that we are checking in to see, are you engaging with your housing case manager?
Okay, so when I'm looking at a 28-day increments for authorization, is this a phone call that the hotel is making to you? You are making to the hotel, but it sounds like you're placing the hotel's need onto the individual staying there. I'm trying to sort that out.
It's really, it's because it's complicated and it, all of that. So the 28-day authorization is for the client. So they are told you have 28 days. And then you will need to call us and we'll say,
But
"All right,
I'm there from December to April. Why do I only have 28 days?
so you're not guaranteed a December to April."
Oh, how did that happen? Trying to sort that out.
There's no guarantee, right? It's like, so I have 600 households who are eligible for GA right now. And I have to tell them, I'm sorry, there's no space for you. So there is no guarantee. The same thing I had to do in July and August.
Well, this is different. This is adverse weather.
Right, but if we, maybe that will help. There's a natural capacity. So right now I'm using just over 1,400 rooms. That's what I have to offer. So if you come here, you're not, and say, I need a room, you're not guaranteed a room. You
If I
only-
meet all the criteria and I follow all the rules, I don't have the room.
Correct. Because
How did
if we
that
do
happen?
not, because there aren't enough space.
But where is that anywhere in our legislative or in our legislation or our statutes? Maybe you can get back to me with that, but I have a problem with that. That means I'm going into this program where I know I'm safe from the cold weather with my kids or my disabled son. And you're telling me that I'm on pins and needles for the whole time.
But there's a limit to the rooms, right?
Yeah,
So we've got 1,100 rooms or 1,400, whatever we got. We got 600 more families. So we have people that are living in their cars.
you're gonna kick me out and you're gonna bring
Well,
someone in the car for
I
28
think what I'm
days.
hearing is there is a check-in, you don't get kicked out after 28 days. But if you're destroying the room, if you're dealing drugs, if you're,
But Senator, I just said I'm following all the rules.
okay. if
And
you're
I'm doing
following all the
everything
rules,
right, and I have a
something
disabled son,
else. Right,
and now I'm told that I only have 28 days. This is a problem.
You get, I mean, I agree. We don't have enough space and we need more shelters. We need more housing
Well,
offers.
no, we know that. We
Right.
absolutely know that. That's key. Maybe we should open up the Miller Center at the Champlain Valley Fair again, the way we did when we had COVID. Is there anything about looking, this is an emergency. Is there anyone looking at an emergency opportunity in some of the, there may be a warehouse up in Orleans County. I don't know.
It will come back down to what we had talked
I
about
know.
before, right? It's
Workforce,
staffing. Yeah,
staffing, I know.
and people wanting a shelter in their community. Like it is a really real struggle that we
I know, it's a
have.
big deal.
It was just,
I get it.
so
painful decision. for-
Oh, but we are now trying to get a picture of what we're hearing from when we hear about lived experience and what people are going through. So thank you. I know that you are on the spot, but this is a problem. This is a huge problem.
we agree,
It's an emergency.
we agree. And we're hoping that we can, find some
Okay, we'll
good
keep going.
solutions together.
I didn't want to let that one lie there.
No, that is fine.
Same way with the other side with the 14-day increments. It's the same thing. Okay, yeah. I'm here for 14 days. Then I gotta pack everybody up, go somewhere else, or I'm out on the street and we're hearing those stories and it's really concerning. That concerning is a very light word.
Same time with 1,400 units of affordable housing on. is anybody tracking, do we get any of those, the people that are in the shelters into permanent housing? And we are with that.
So there are,
Need to make.
that's all right. Not a problem. So yes, but it is to the same extent a challenge, all right, of being able to fully track that and just understanding, I'm talking about the 1,400 households that I'm housing. We also have, I want to say it's close to, maybe it's just under 600 shelter beds, right? So we have a lot of need, for permanent housing. We also are going to need some other options. We do need more specialized shelters, for people who are not going to be able to go, and independently live.
Yes.
Which is a lovely segue. I will stay high level on this one because this isn't necessarily my area of expertise. But this is, all right, so I was just a little off. We're at 618 households that we are able to support. These are the counties. We do have the Housing Opportunity Program, HOP is what we refer to it as, have added more capacity. We have some more seasonal shelters. We do engage, I think we just had Burlington, forgive me for forgetting the other area. I think it was here in Barry, that stood up some extreme cold weather shelters, and that is in conversations with us. So we are trying to have some more options. And here are some information on additional shelters that we're hoping to bring online.
When you look at this table and then compare it with a previous table where Rutland has a really high number of folks. This is low. So
Rutland is an area that we continue to have conversations, and I think we've been having a lot of good conversations. But it has been a slow process, but I do think we have a lot of engagement there and are trying to find a path forward, and something that will work for the community.
Okay.
I believe that was it for me, so I will stop sharing and I'm happy. I think there was just one other excuse me, item that had come up before the resource. Spending that you mentioned in Intel card was something that had come up. And we do understand how it can hinder people's ability to be able to save, to move into something that is permanent. What it also is that we can have someone with $10,000 in the bank who we would pay to have a room, and then we have someone who has no money, and that room is being taken up by someone who had the ability to pay for their own room. And so once again, it becomes for us, it's a capacity issue. We don't have enough space. We can't support everyone. And so how do you make those choices? And I know that you'll hear tomorrow, some ideas of the task force of how we might be able to help support people. There's an infrastructure that would be needed. Someone that's going to have to oversee, any potential idea, which also includes needing staff to do that.
yeah, so it goes back to one of my original comments. We don't have a housing problem. We got a people problem, and in a lot of different ways. And so what we need is to be linking the people with needs to the housing available. And as housing is built, would seem there must be some priorities in place administratively to get folks. And I think it goes to Senator Cummings' question about affordable housing, getting people there. And we have great programs for helping folks find jobs through higher ability or others. So do you have a sense, you must, what does the budget have in it related to this? Because I haven't scanned the budget thoroughly yet, and we will be doing that down the hall. But what is in the budget for GA and other housing people problems,
Right.
solving the problem.
Right. I think there's quite a bit there for housing. I really noticed the expansion, and I don't want to use acronyms except for that's how I know them best, is like the VHIP.
Yeah,
Mobile
well,
home.
VHIP is really important because it's extended affordability, right? So-
Yeah, and I believe that there is a housing bill that's being there's a review that today, I want to say like 2 or 2:30, and that's where the experts out of AACD will be presenting. Here is the package, because you're right, we need a lot of investment in how are we able to, where we found success, and I think it is not necessarily building brand new, it's rehabbing what we already have so that we can put people in quicker. There's also some money in there. The Office of Economic Opportunity and being able to keep shelters, that we have started running. And then for the general assistance program, for us, it is, I want to say it's just over $30 million, and to be able to continue to run the program that we're running right now, which I know I'm hearing maybe it will not be welcome news by everybody, and that is fine, but I think it's, a starting point, and it's different than when we started last year. That's what I'll say. So we'll give people, and I guess I would add, it would at least be consistent for Vermonters, because that's also part of the confusion of how long can I stay? What are the rules? Because that has changed so much. That is also not doing a service to people.
We need some connection between people and potential more permanent housing. And I continue to see that disconnection. So when we had VHCB and Vermont Housing and Conservation Board, and we asked, how can we have new housing or housing available for folks with disabilities? And we're doing some of that. I know in Moncton, it's privately funded. How can we increase that model? And we've asked consistently for housing that is more permanently affordable for folks who have problems, chronic illness or other. And it would be great to see some recommendation from the administration that links Alex Farrell with Miranda Gray.
I do spend a fair amount of time with Alex Farrell. So yeah, we're trying. And I think it is, again, right, a lot of parties that want a lot of housing for.
Everybody wants it. I know we want workforce housing. We want, we want all of, right now, this is really sad. And I look at what's happening at the federal level, where all of our safety net is in jeopardy. We need to accept our responsibilities. And I know you do that. You talk through how very concerned folks in the agency are and the department are about working with people, giving up their Sundays, giving up time. We get that, but we need to work together on solutions.
Yeah, I think this department is between a rock and a hard place. You're out there, you see the need. We're only giving them so much money in so many rooms. And so they get yelled at because they can't do what needs to be done. We're trying to put a lot of money in a lot of different places, and we don't have the resources right now to do what needs to be done. We could be losing. And we also have people without homes are not homogenous. You have folks that all they need is an apartment. They have jobs that they've been priced out in the market. They've been through a divorce. They've lost their home. They need that. We also have folks with serious mental health and or addiction problems. And they're not going to make it in a subsidized rental unless we can get them the treatment and support services. But we don't have enough of that either. And then people have to be willing to do that. And there's a certain number of people that won't. There are a lot of people who don't understand. No, and you're living hand to mouth and you're into survival mode. You're doing what you need to survive today. We've lost 2 people here. And you know, that really brings you up short.
Well, not with the good news. Okay. Any other questions for Deputy Commissioner Greg?
Can we say thank you?
No, thank you. I appreciate the time you spent to put this together and bring us the information. I know it's just, you probably used it in other places and other ways, but it's, important. I just got a message that says Elkhart is canceled. Well, no, we'll have to check that one out. No. It may be an old Zoom that's been canceled and the new Zoom is going out. Okay. All right. Well, sorry for that.
Just canceled all your money, so you
Yeah.
you can listen to.
No, thank you very much. And I know how hard you're working on all of this and we appreciate that very much. But we also, I think we agree in this room that we have a significant, overwhelming emergency that needs to be addressed. And it will be helpful to know what's in the governor's budget and how those administrative connections are being made so that we get a smooth pathway for people.
I anticipate I'll probably be back. to
I know you
talk
will.
more about
We'll
that.
probably see you tomorrow, right?
You will, yes.
Okay, good. All right, so committee, we've got some time here before we go through bills, and I'm gonna suggest that we go that we take a break